Welcome to Innovating Clinical Trials, the podcast designed for clinical research professionals eager to deepen their understanding of clinical trials through concise, insightful segments. Join your hosts, Liam Eves and Ted Trafford, as they uncover the core issues in clinical research, reflect on the industry, and challenge conventional wisdom.
Joel, to your point around pricing, I think last time when we spoke, we said, everyone's sharpening their pencils on a pricing perspective. What is like the second order consequence of that? Is it a case of that is then become the new norm from a pricing perspective? And
no, it's not extreme. It's not extreme by any sense, and it is mostly concentrated on the FSP side. And that's because the FSP side, FSP is a commoditized business. The large pharma will send the RFP out and they'll say, we need 45 data managers for the next 24 months. All right. Mm-hmm. They may state a preference for where those data managers are located, how much experience they have, things like that. But it's a body shop concept, as in human body shop concept. That could be structured different ways. It could be, hey, we want those people to be your employees, like your W-2 employees. You pay them, et cetera. You provide their benefits. You line manage them. Or it can be, you just go recruit them. Or they're your employees, but we'll manage them. Or they'll work in their systems, or they'll work in our systems. There's all kinds of permutations of it, but it is commoditized. Because you say, hey, we need these 45 people, and those 45 people, some percentage of them probably don't even exist at the CRO. Yeah. And so you can't say, our 45 people are better than that company's 45 people, because all those 45 people, they're not even in-house yet, especially if it's a staffing model, right? So it's about, our recruiting process. Well, corporate recruiting is a hundreds-year-old game, right? There's really not that much that's innovative there. So long story short, it's a commoditized type business, and all commoditized businesses tend to be more price intensive. Yeah. And, CROs have a small part of their business towards FSP. The larger ones fit 10 to 20% at the most. So that's not nothing. Yeah. And if you're having a tough quarter, as some of the actually non-public ones are, then, or a tough year, then it could be a way to kind of fill in a resourcing gap, help the sales numbers a little bit. And it might mean you're a little extra willing to put some rock bottom rates in there that you weren't to before.
Because I read, just to touch upon the FSP thing, why are we hearing, or should I say, why am I reading quite a bit around a lot of organizations saying, the big rise in FSP? Like, is it really a thing?
I'll tell you, Liam, it is something. There has always been a mismatch between how much pharma say they have and want to do versus how much they actually do.
Yeah.
And you can't really get great industry numbers on it. That's why I look for what percentage of CRO revenues are related to FSPs, because that's the ultimate flow through, and it's relatively minor. One of the reasons for that is because as a buyer of services or anything, if you're buying a commodity, you have a lot more leverage. You have a lot more transparency into the pricing, and you feel like you have a lot more control over what you're spending. There are all kinds of trade-offs to running FSPs at scale, to buying FSPs at scale. And we could spend all the rest of our time going through that. But that mismatch, that's not new.
Yeah.
Oh my God. Yeah. That's not new at all whatsoever. And as you mentioned earlier, Ted, Steve Cutler at Icon, he said it best. It's more about, certain people and personalities who are attached to it. I'm not even saying that in a bad way. They've had good experience with it in the past. There are a number of large pharmas where certain divisions have been using FSPs for decades. Eli Lilly, great example. But it is a pendulum.
It is.
And right now it's heading a little bit more towards more usage. But things happen when that pendulum goes all the way. Yeah. Like in any industry, when a lot of demand starts concentrating on a commoditized service, the price goes up. And so a lot of times companies will dabble in FSPs to try to get cost efficiencies. Well, if the price goes up, you start losing those cost efficiencies. And then you say, well, is it still worth going out and having to hire all the staff in-house to manage these FSPs, spinning up all these systems for these FSP people to work in. And then if you say, well, let's not spin up the systems, let's not hire up all these people to manage it, then you're asking the CRO to provide the systems, provide the infrastructure, and then you're paying for that. And then the pendulums. Oh, okay. Then the pendulum, and then Joe Schmo gets fired from Pfizer or wherever, and then the pendulum keeps swinging back until, he or she gets hired at wherever else, and you just get
history repeats.
Yeah, isn't it impacted as well by the pharmaceutical companies or the biotech's own financial picture, where in some cases it makes more sense to engage the CROs more to decrease internal costs and just the impact on
that's where it's really a large pharma game. Is the smaller biotechs, and especially the smaller you get, again, they just don't have the infrastructure to have a service provider provide them staff to do the work without oversight, without systems and things like that. So it is really a larger pharma game. I'll give you guys a real life example of what winning an FSP can look like. Years ago, not that many, and this was years ago, and these systems have become more sophisticated. I was involved in a reverse auction when I was in-house at a CRO, and talked about the body shop concept. In this reverse auction, I won't say which large pharma was hosting it, had a list of roles, and then you would enter your proposed rate for the role, and your competitors were in this auction at the same time. And I say reverse auction because you would put in your rate of $100, and then it would get bid down.
Interesting.
eBay, right? Starts out at $20 and you do 21, 22, 23. This is you put in your rate for a data manager at $100. And obviously you wouldn't see who the other players were, but CRO number 8, they bid it down to 98. Did we go to 97?
Interesting.
Right.
And then
I can mean that ring in 3 notes.
I was in that office for 8 hours that day. The CEO popped in a couple times to check how it was going. He was pretty disgusted by the process, but you talk about a commoditized service. You could not do a reverse auction for a full scope.
Yeah,
or if you tried to, it would just be ludicrous. But I'm already starting to feel grossed out by how much I'm talking about FSPs here.
Yeah,
we'll change.
Well, I have one in terms of we spoke last time around sites and just the sort of situation for sites. You posted in there about velocity, and I wonder if you could just talk about the incidence of velocity and what you think that means for the industry.
Yeah, and an interesting comment that a business development person at Velocity publicly after that. So I just found it amazing that they put 55 sites on one trial. I just that's worth noting. And again, I primarily write these for myself. So when I saw it, I was like, open my running notes quarterly tracker. I'm like, that is worth noting. One, everyone should subscribe to that newsletter if you don't. They're pretty transparent about their milestones and things like that. And it's not some of it's marketing, but it's not like, hey, we put 55 sites on one trial, then here's 3 paragraphs of why we're so great, our company history. But I thought that was really cool. But it speaks to the scale that some of these networks are getting to. And, there are others that are, growing very rapidly in scale. And it speaks to me of the continuing consolidation of site networks that I personally think will continue. That I personally, this is just my opinion, think is a very good thing. And I'm eager to see progress. But what was cool is then I think it was a VP of business development from Velocity reposted it after that and talked about, totally unsolicited, talked about how they are really trying to go around CROs, not in a bad way, but through their business development, try to get more direct business development efforts with sponsors. Yeah. That way, by the time they send the RFPs, hey, we want 50 sites for this trial, but CRO, we only need you to help us find 20 because we've already picked the first 30. And, they mentioned that, we're having some struggles with it, which mental note for me was the largest is having some, I just kind of tucked that away in the subconscious, but I don't think they'll struggle forever. And, but he also mentioned about some of the proactive steps they're doing to become more appealing directly to sponsors, some risk sharing, risk-based, contracting and things like that. So I found that fascinating.
Yeah, it'd be great to get both of your thoughts on this. Actually, is that I do think that there's a world in which that this certainly some of the largest site organizations are able to get closer to sponsors, because I think sponsors ultimately want that relationship as well. It doesn't have to go through a middleman, right, in order to deliver it. And then I do wonder whether there's opportunities not just one relationship where sponsor to CRO, but maybe it's more fragmented than that, in which that you have a CRO specialist that is going to deal more on the data, shall we say, the data management, regulatory, and so on and so forth. But then you have another relationship that's all about essentially the trial delivery at a site level.
I'll just mention real quickly. This was reposted by basically a VP of sales who has a sales team. And there's a lot of talk about, is private equity good or bad for sites and site networks? I have now seen multiple instances this year where private equity has acquired a stake, or if not an entire stake, in a site network. And two of their first hires is a professional finance person, maybe a CFO that they've never had before, and a sales team.
Yeah.
Salesperson and a sales team. And so you get some of these site networks where they're at a scale where it makes sense to have a professional business development team. And you have people doing that full time for you, 40 plus hours a week. They're doing the same types of things that CROs do.
Yeah.
They're getting access to pipelines. They're getting to the right places to meet with these people to get direct access. And I think that's an awesome thing.
Yeah, and you're also kind of meeting the sponsors where they're at. So a lot of sponsors now are developing their own in-house site relationship teams, and to this very specific goal to build relationships with sites and site networks. And I think it's a very good thing for our industry. I think that it helps bridge the gap, helps address issues with studies that need to be resolved that are not being resolved through the normal channels. And I think there's a lot of potential for continued evolution there with the relationships between sponsors and sites, for sure. Yeah.
I on that same velocity slide, I linked to a video where it's Paul Evans, their CEO, and the heads of several other site networks and a private equity guy talking through a lot of this. And it's 51 minutes. I watched it, I think, on 1.5 speed, right? It was perfect. It was a great video. And then Dan Safera did a video with a private equity guy several months ago. And he talked about what a private equity company looks for, and then what they come in and do after they acquire a company. Public perception is that they come in and slash and burn, right? And then dividend the hell out of the company, sell it, and get out. Not true at all. What did I just mention? A few minutes ago, they come in and they hire. Right. They hire professional roles that will help grow the business and run it more effectively. So, yeah, food for thought. For anyone thinking that they're some demonistic entity. There's some bad ones out there, but really not in this industry. Yeah.
That's brilliant. Go on, Ted, sorry.
No, I was just going to say, can we talk about Veeva? Yeah, I'd love to, for people who haven't seen the report, why don't you just share a little bit about, what Veeva came out with and said and what they're planning to do, because I think this is fascinating.
Yeah, Veeva, alongside Medidata is part of a much larger organization, Dassault software company, Dassault Systems. But those are the two main publicly traded players. But you get a lot more visibility on Veeva. Veeva is growing, Medidata is not. And what's fascinating about Veeva, just a little background on them. They are still founder led. I don't think they're fully founder controlled in terms of ownership, but I don't know for sure. But founder led, and they do these kind of big 5-year announcements, like the kind that I'm sure when they did the first one, if I was tracking them then, I'm sure I rolled my eyes, right? We're going to have $1 billion in revenue in 5 years. And it's it's what I say. I said, next year's always looking good, right? 5 years from now always looks great, right? Yeah, we think we're going to have a rough year in 2030, right? You don't know this. You don't know this. So this was their, I believe, third 5-year goal. And they have met and are expected to exceed. They met, exceeded the first, and are expected to meet, possibly exceed the second, which comes due next year, $3 billion mark.
Wow.
And they put, I mean, these are smart guys. So they put a table in their investor deck that showed, yeah, hey, we're making this big new goal. Here's our track record. And so the next new goal is to double the 3 billion to 6 billion by 2030. And so when I first saw that, it was paired with another headline that Viva is going to go into, is exploring to go into non-life sciences areas, what they call enterprise horizontal applications. Basically non-life sciences. They're already in one, actually. They do have a consumer packaged goods business. It's small, but so they do have some experience with this, but they are like firewalling a separate team to go experiment with this. This is like something you see, Google and Amazon and companies do, right? Where like you just go off, you've got complete independence, you report directly to the CEO, you go do this thing. So I thought, okay, you're going to double your revenue, but you're going to do it by going into these other industries and maybe acquiring companies. The doubling of that goal is purely life sciences without acquisitions. And so just me, that mental note of how does next year look? How does the longer term outlook appear? A company with a proven track record of being able to multiply their business in a relatively short period of time, multiple times, still sees a doubling potential against a $3 billion incremental potential over the next 5 years. And it's a company that's proven that they can do it. And it's within life sciences, and not just within life sciences, but they do the commercial part of pharma, and they do the R&D side, the world that we live in.
Right.
And they expect the majority of that opportunity comes from the R&D side.
Wow.
That was just, another little data point that stuck in my head that I thought was worth mentioning. So they expect to hit that target purely through life sciences organically and going into product areas where right now they're still developing, like RTSM and some places like that. Anything acquisition-wise, anything horizontal-wise outside of life sciences, that's all incremental to the $6 billion opportunity. And I was like you, I was just sitting there.
That's incredible.
Shaking my head. I think that's just an example of the thing founders, why I have like a soft spot and a bias towards founder-led companies, because they can think of things and they can just do stuff that a lot of others can't or just don't even think about. So I thought that was pretty amazing.
That's pretty high agency right there.